So I'd like to invite James Bogue, who you've heard being referred to a couple of times already this morning. So James is the place partnership lead manager. I've got it written on a bit of paper in my pocket, but I'm not going to take it out and read it. But that's close enough, James. James works for Exeter City Council as their place lead, effectively on the LDP work with Exeter and Cranbrook. And just so you know, full disclosure, I'm right. I think James used to also work for an active partnership. So James worked for Active Devon for a while. I've got that right, haven't I? And then.
Thanks for the introduction, Craig. Hi everyone, it's great to be down here in Cornwall this afternoon. I'm a regular visitor to Cornwall, more personally and socially than professionally, so it's good to be down here today to talk to you a little bit about the work that we're doing in Exeter and Cranbrook in partnership with Sport England. I'm the Place Partnership Lead and I work for Exeter City Council. So the Place Partnership work with Sport England, formerly the local delivery pilot, is embedded within Exeter City Council. Our brand for the work is Live and Move, which was a sort of a co-designed brand with the community and a range of stakeholders, which hopefully gives it a bit more of a kind of a front-facing everyday movement look. I've been working on this alongside James Watmo since 2017. So I think a success factor is I'm still here talking about it enthusiastically today, 7 or 8 years down the line, and hopefully I can give you a bit of a flavour of some of the things that we've been up to. And I guess some of the things that you might want to be thinking about from now really on in this journey, and some of the things that we put in place 6, 7, 8 years ago, which have stood the test of time today, particularly around kind of prioritising and some of the foundations that we put in place. I'm sure there are lots of conversations around Cornwall-wide work in specific places. I'm going to tell you a little bit about how we approached that in Exeter and Cranbrook. Obviously, it's not going to be exactly the same here, but I think some of the principles of identifying where you may look to focus your energies and your resources is really interesting. So we established in 2018. It was a partnership between Exeter City Council and East Devon District Council. As well as Exeter as a city, we included Cranbrook. I don't know if anybody in the room is familiar with Cranbrook. It started its growth as a new town back in 2010. It had some public health funding through the Healthy New Towns programme. And it's going to grow to a town of around 25,000 people across 20 years. So from Green Devon Fields just outside of Exeter to one of the largest towns in Devon. Our initial approach to Sport England was very much around how physical activity could support challenges in our local system. And the two main ones being how physical activity could support individuals' health and well-being in some of the more complex areas of the city, and also how physical activity could support some of the challenges we have in Exeter around our transport infrastructure. So looking at walking and cycling and active travel, those were our two main areas of focus. And as well as identifying some specific places, and I'll talk about the kind of methodology behind that, we wanted to focus at influencing strategy and policy across the city and the patch, so that physical activity was part of building new policies, new strategies in a variety of different sectors and systems across the city. We have had some success. It's certainly not the end of that journey, and we're delighted that we're one of the deepening place partnerships with Sport England to extend this relationship to 2028. In 2018, we worked really closely with our public health partners to identify some of the indicators of inactivity, obesity, life expectancy. We put all of those, we worked alongside a local evaluation partner to then identify what were the 20 lower super output areas within the city of Exeter and Cranbrook that had the highest levels of inactivity. The work has evolved through our strategy. Those communities couldn't really connect to that language. So we moved to a strategy which now focuses on 12 really understandable neighbourhoods within the city. They've got the highest levels of inactivity. And that's been pretty unwavering for the last 6 or 7 years. So the lion's share of our investment from Sport England will be going into these very specific 12 places within the city. Early on, we appointed a local evaluation partner. So we commissioned and went out to tender, and we're working alongside an organisation called the Social Research Unit. They're attached to Plymouth University, formerly Serio. They've been alongside us for the last 5 or 6 years. And over that time, alongside Sport England and their national evaluation team, we built up a local evaluation methodology, which, as James said, is not the traditional bean counting participation numbers. It's much more about systemic change, system maturity. We do have a very robust impact measurement. And the approach that we use is local active lives. So I'm sure you'll all be aware of the National Active Lives Survey. We took a decision very early on to invest in enhancing the Active Lives Survey locally. So every year we run a survey of over 2,000 people in Exeter and Cranbrook from these areas. So we're able to track and trend the active lifestyles of those in the neighbourhoods that we focus on the most. It's great to be able to say that we are starting to track a year-on-year reduction in those that are doing the least amount of activity. I will share in the room, I won't go into it in too much more detail, but I will share with the room links to the methodology, the insight, and we have a dashboard and now 6 years of trend data around physical activity levels in these areas. I can also introduce relevant people to our local evaluation partner as well. All of that data and insight led to a new strategy for Live and Move, which we developed with partners and stakeholders back in 2022. And as I say, the work that we've done in those areas, largely through a few sort of delivery vehicles, which I'll describe shortly in a minute. And I think those of you in the room from the voluntary sector might be interested to learn of Wellbeing Exeter, and I'll talk about that shortly. Although we are focusing on these 12 areas in Cranbrook, as I say, a lot of the work through the capacity of the team and the work being embedded with the Exeter City Council and the wider governance we have with our stakeholders very much at policy level. So we've been working alongside our planning team in terms of delivering the Exeter local plan, and our transport team at Devon County Council in terms of delivering our local walking and cycling infrastructure plan. So I'm sure you can start to see that the work is very much a cross-system rather than specifically around sport and physical activity. Back at the start, and I would really encourage, if this work hasn't already been done, thinking around how to build your local theory of change, what the overall vision and ambition is, and the sort of resources and support you'll need to achieve those longer-term impacts. On the right-hand side, we designed our theory of change wheel, which was very much about how physical activity was going to connect to those wider systems. At the heart of our approach is asset-based community development. So we work really closely with the Wellbeing Exeter Alliance within the city. There are 2 main parts to Wellbeing Exeter. One is a social prescribing arm, where we work with GP surgeries and other organisations across the city to refer people into Wellbeing Exeter. Once somebody is referred, they get the opportunity to have a conversation, an individual wellbeing conversation with a community connector who is based in the community. And then they will build an individual wellbeing action plan with that person through the lens of physical activity, through walking meetings, through introduction to people in their local neighbourhood. They might join a group, they might join a class. The second element of Wellbeing Exeter is that asset-based community development model. We have a community builder in every ward of the city. They're people that are out and about, hosting focus groups, listening workshops, door knocking, and really doing that grassroots insight conversational bit with our residents to understand their needs and how physical activity can be added into their life. And the magic happens when somebody is referred into the system to have a conversation with a community connector who is then able to signpost and hold the hand of that individual to join one of those opportunities that are happening in their local ward. We've done a lot of work with a cultural network in the city called Inclusive Exeter. There are 7 or 8 different network organisations from a variety of different cultural, faith, religious backgrounds that come together to form Inclusive Exeter. We've helped build that network and embed physical activity in everything they do. If you come to Exeter, you'll see a lot of cultural events that celebrate physical activity as a priority within everything that they do. We've trained local community leaders from the mosque, from the Nigerian Association, Hong Kong Association, and they all come together under one umbrella of Inclusive Exeter to deliver a wide range of cultural events across the city on a very regular basis, and they have a physical activity programme with lots of amazing things happening. And the Sport England resource through our place partnership has really helped to form, grow and embed Inclusive Exeter as a really strong network within the city. Just touching a little bit on Cranbrook, which has been a fascinating and tough journey over the last 5 or 6 years. Really interesting working alongside governance at 3 different levels. We have the town council, we have the district council and the county council as part of the network. And it has been challenging at times to get everyone onto the same page around what physical activity and the identity of the Healthy New Town in Cranbrook looks like. One of the biggest challenges we face is that it doesn't have any traditional community sporting infrastructure. So we've very much had to work with the natural environment and the country park. And I think there's probably plenty of learning from Cranbrook and the growth of a new community that maybe we can have a conversation about areas in Cornwall that are growing at a fast rate. We've worked alongside planning and other agencies to look at the real challenges that have been created by a new community. And Cranbrook has one of the highest single car usage rates in the country through some of those planning challenges that they faced, because people have to get in a car to take their children to school, to the nearest supermarket, to services and utilities. So every journey is made in a car to get to some of the normal things that you would do. And that's created challenges and issues. There's behavioural issues in Cranbrook around that sort of car usage. So we're working very hard with local partners to explore active travel in its broadest sense, but some of the interventions that we can do with local partners to get children and families on their bikes and out and about. I'm conscious of time here, and I've got quite a lot of slides. I'm not going to go through them all, you'll be pleased to know, but hopefully the slides that I've sent through to Craig and Paul and those that you've got here today are more a resource for you, so that you can read them at your own leisure and kind of get in touch with me if you've got any questions. And what I should have said at the start that I didn't was, I'm also here and on this journey with you guys. So the place partnership investment that we've got from Sport England for Exeter and Cranbrook, there is an element of expansion support, working with other places. I haven't had the formal conversation with James and Russ, so they'll kick me under the table if they need to. But I'm really keen to work alongside Active Cornwall, Cornwall Council, and other partners in the room as you go through your sessions and you design the work. Hopefully, I can be of help through the experiences that we've had. A lot of people ask, and you'll get asked this constantly, you will be asking the question yourself, and you will also be fielding questions from people outside in the room. What is the impact that you're having? If you can't tell us the number of participants and the number of projects that you've got, what is the actual impact you're having? Well, the local active lives data that we deliver on an annual basis gives us a really robust academic evidence behind the work that we're doing. And these are just some of the things that we're starting to notice in Exeter and Cranbrook since 2018. Exeter is a relatively affluent place, but there are some real pockets of deprivation. Somebody mentioned the life expectancy gap nationally earlier. There's a 12-year difference in life expectancy if you live in Topsham in Exeter compared to the city centre. So we have huge inequalities in Exeter with less than a mile distance from A to B. So that's why we focus our resources and our work in those areas of highest need within the city. We've seen a narrow of the gender inequality gap in terms of physical activity, so male and female participation rates are really similar, which has changed since 2018. One of the things that we have worked really hard on is supporting our cultural and our ethnically diverse communities. and there's been a significant recovery of activity levels across the British Asian populations in the city since COVID. The thing that we're really interested about and makes us the most curious is that year on year, the level of the people that register and report doing absolutely nothing, so not just inactive, but report that they're doing close to 0 minutes of physical activity a week. That's been going down year on year and massively bucks other trends nationally in terms of inequality. So it's something that we're continuing to investigate and work with local partners in those priority areas to look at. Wellbeing Exeter is really, really important to us. It's a strategic alliance of voluntary sector organisations. We commission CoLab, who are a fantastic charity in Exeter based in the city centre that deliver a range of mental health, street attached, a wide range of programmes focusing on individual and complex needs, wellbeing. So a lion's share of the resource that we get from Sport England goes directly into community and charity organisations. They work alongside Exeter City Community Trust, our professional football team's community programme, and Exeter Community Initiatives, which are an evolved version of the voluntary and community sector organisation within the city. They come together as an alliance to deliver Wellbeing Exeter, and the academic research shows that if you are referred into Wellbeing Exeter, you have a significant increase in your personal well-being. And through some of the programme strands, we've also started to identify that there's a significant increase in the amount of families doing physical activity together as a result of signposting into Wellbeing Exeter. I'll quickly move through this because there's a lot of text there, but just to link it back to some of the wider system maturity kind of metrics that James was talking about earlier. We, on a 6-monthly basis, report back to Sport England on our system maturity, and we'll go through a process with partners around a range of conditions, things like distributed leadership, governance, community involvement. So we're constantly looking at the activities, the programs and the policies, and how it's enabling us to become more of a mature system around physical activity in Exeter. Through our deepening approach to Sport England, we very much said we wanted to focus on 2 of their national outcomes. One, the reducing inactivity outcome and the reducing inequalities outcome. We're unashamedly focusing our resources on those 2 specific outcomes within the city in Cranbrook. And I think I'll potentially just finish here to open it up to the floor because I'm just conscious of time, Craig, and I want to keep you guys on time today. This is our high-level programme overview. On the left-hand side, you've got our City Council priorities around building great neighbourhoods, around healthy and active, around net zero carbon. On the right-hand side, you've got the Sport England 4 outcomes. All of the things in the middle of that diagram are our interventions, our programs, the work that we're doing on the ground, both from a policy and a delivery level. And those are the 4 audiences that we are seeking to work with in our priority areas, those on low incomes, those with long-term conditions, culturally diverse communities, and children and young people. So as well as doing system-wide work across Exeter and Cranbrook, we do have focus communities within that. It's been great to work alongside Sport England. It's been challenging at times. The relationship has been very different. We have designed a lot of this work in partnership, both with Sport England, but also the other local delivery pilots across the country. Those nationally convened spaces and spaces like this that you can bring expert colleagues together to have those conversations and put a framework in place that you can shout about the work and work alongside your communities has been really important. And I'd just like to finish by saying thanks a lot for inviting me down from Exeter today. Look forward to working with you all in the future. I know our Chief Executive from Exeter City Council, our portfolio holder, and other colleagues from within our organisation and local system will be keen to meet relevant counterparts. And I've already invited a couple of Cornwall Council colleagues up to Exeter to have a look at some of our facilities and find out a little bit more about how we do things and how it might help you in the future. So thanks a lot, and I'm welcome to grab a chat with anyone later on in the day. Thanks, Craig.